CDC data shows 6.2 million people visited emergency rooms because of mental health issues in 2020.
Unfortunately, many emergency rooms are not equipped to handle these types of issues. Newswatch 12's Nick Van Zyl has more. Nick.
Thanks, Dan and Jessica. When you have a fever, you may take some ibuprofen. Same with a cough drop for a sore throat. But what do you do when you're experiencing crippling anxiety or suicidal thoughts? That's what Aspirus social workers like Debbie Merkel are trying to answer.
We need to do better. We need to start making our mental health a priority.
A person's overall well-being involves more than simply physical health.
Lack of access to health care, poverty, lack of education.
May is Mental Health Awareness Month, and Aspirus social worker Debbie Merkel says all of those factors play a role.
One of the biggest social determinants of health that our community is facing is safe and affordable housing.
This means people might have to decide between paying their rent or going to a mental health provider, if they can even make an appointment.
It takes approximately 3 months to get an initial appointment with a provider, and for a psychiatrist, we're talking about wait times as long as 6 months or even longer.
Mental health issues tend to get swept aside because the symptoms can come and go.
The average American sees a medical provider approximately 4 times a year. But when it comes to mental health care, people wait until they are in crisis before they seek out any care.
Merkel says it's important to establish care with a mental health provider to have a plan in place before a crisis occurs.
How can we be a good role model for our youth and for our children if we're not doing it for ourselves?
If you're having trouble finding resources near you, contact your healthcare provider or county health department.